Hey, it's Dr. Ballard. If you're watching this video, it means you just got signed up to have your hip or knee replaced. I want to use this brief video to highlight a few important things that will take you from today to the day of your surgery and through your recovery. So as you start on this journey here with us at ROC to get your joint replaced and change your life, we have a lot of great people in the office that are going to help you through this whole process. One of the most important people to help you with this will be my wonderful nurse, Caroline.
Hi, I'm Caroline. I will be the one to see you for your first post-op visit. I will be the one to answer any questions or any concerns you have both before or after surgery.
Caroline's going to be a big part of this whole process for you, and you'll find she's really helpful. Now, in addition to Caroline and great people like her, we have some wonderful technology in the office that we've adopted. One of these, and the most important one, is called mymobility. Communicating with my office before and after your surgery is really important. Traditionally, we've used the telephone, and that's worked pretty well, but it's run into some limitations. So at ROC, we're adopting new technology to move beyond the telephone and make your communication with us much more efficient and much quicker. When you schedule with my office and receive this email, you've been given instructions to sign up for this program called mymobility. It is really important that you sign up for this program right now. You register, get all your information in, and if you have any problems doing that, I need you to contact my office so we can get this going. mymobility is an application that goes on your smartphone. Think of it as an education and a communication tool. It'll make your life during your recovery much easier. So starting today, up until the day of your surgery and 90 days after, mymobility is going to be your key to communicating and connecting with my office. mymobility works Monday through Friday during business hours, so 8 to 5. Other times in the evenings or on weekends, you'll make the traditional phone call to my office. So during the week, the way you're going to communicate with us is through text messages. My wonderful staff at my surgery center, my staff here in my office watch this application and can answer and respond to your questions very rapidly. Every day, this application is going to send you small bits of information that deal with your preparation for surgery and deal with your recovery. The messages will be timed for whatever part of the recovery you're in. They might be short videos, they might be short paragraphs dealing with problems you might be encountering. Your first post-op visit with my office, if things are going well, we're going to be able to do that visit on telemedicine without you leaving your house. The telemedicine function is very user-friendly, very powerful, and will save you a lot of time and give you a much more convenient access to us for that important checkup 10 to 14 days after your surgery. The next thing I want to highlight in this video is to talk about getting ready for surgery and avoiding last-minute cancellations. When you came to see me, you filled out a health form that told me all about your medical history. It's very important that I know everything about your health history, so something doesn't come up at the last minute that could cause an unfortunate last-minute cancellation of your surgery. So what kind of things am I talking about? First, things like diabetes. We need to know that your diabetes is well controlled, and that would be through an appropriate A1C level less than 8. If you have heart disease, I need to know if you had a heart attack. If you had a surgery, I need to know if you have what's called an arrhythmia, which is an irregular heartbeat. Another health issue to talk about that's very important is sleep apnea. If you have it, it has to be treated. If you're at risk for it, it has to be tested and then treated. Failure to either treat sleep apnea or find out if you have it can lead to a very unfortunate last-second cancellation of surgery, which would be terrible and inconvenient for you. So we really want to avoid any of those last-minute cancellations. One more thing people don't think about much is their teeth, their dentition. You have to have a recent trip to your dentist within the last 6 months to have them go through and make sure all of your teeth are healthy and none are having an imminent problem. One more thing about your health is we are going to get some lab testing done prior to surgery. You may not need it and you may need it. It depends on your age and overall health. My staff will contact you about getting those tests done. As soon as they contact you, get the tests done so we don't have any unnecessary delays or cancellations in your surgery. One final thing, everybody when they recover needs somebody at home with them 24 hours a day for 3 days. We talked about this in the office. It doesn't have to be the same person. It can be several people, and they need to be there with you all of the time. They're there as a safety measure to help you be mobile around the house, to run errands for you. Please make sure that person is in place and make sure that they are comfortable with their role. If you have any questions about that, call my office. So to quickly summarize, mymobility, the app on your smartphone, get it today, sign up for it today and use it. If you have any questions or troubles with mymobility, call us and we'll help you through that. Second, the issues of your health. Make sure we know all about your health history, and if you have anything you haven't communicated to us, please call us. And get your helpers ready at home to be there for 3 days, 24 hours a day to help you through your recovery. I'm really excited you made this important step to have your joint replaced, and I'm really honored you've chosen me and my team to help you through this. This will be a really important step for you, get you out of pain and get you back to your life. And we will be here with you every step of the way. I'll see you on the day of your surgery.